Hello, everyone. Thank you so much for joining us today. I know we have people coming in. We're so happy to welcome you to our IRI second annual conference. We're going to give it a few more minutes and start right at 12. Welcome. I see more people joining us. We want to welcome you to our second annual IRI Inclusive Research Initiative Conference. Welcome, everyone.
Tamiko, you're on mute.
Oh, yes. Hi, John. Welcome, everyone. I'm just welcoming everyone to our second annual IRI or Inclusive Research Initiative Conference. It is 12 o'clock, so we're going to go ahead and get started. We are so happy that you are joining us today, and we would like to, I'm going to just hand it off to our president, John Dwyer, to just welcome us today. And welcome us today. And then I'm going to have some words after he gives us a welcome and introduction. John?
Well, thank you, Tamiko.
Yes.
The in this day and age that we're living in, it is really important to take a moment and both cherish and recognize the obligation we have as clinical trialists to make the research for new therapies available to everyone. And this particular event, this conference, and all the work that Dr. Tamiko MaGee Rodgers and her team undertakes is central to that thesis, that commitment, that mission, that we're going to make research available to everyone where we possibly can. Now, you only do that first and foremost by maintaining a very strong sense of intentionality. That is to say, wake up every day and say, how are we going to get to places that don't get served? How are we going to make trials effective in places that may not have tau PET ligand or may not be able to provide PET with great ease in those trials that require PET, or for that matter, any of the elements of the neurology studies that we undertake. That's the second thing after intentionality is know your communities and know what good looks like on the ground for those communities. The third thing that Tamiko and the team really stress, and our partners are stressing, is communicating to the folks in the communities we're outreaching to what the deal is, what the genuine opportunity is, why is it good for them? Not, we know why it's good for us, but explaining and doing it with candor and transparency that these studies offer both themselves, their families, and their communities participation in the next generation of either symptomatic treating or therapies that could change the lives of a lot of folks with illness. Ideally, these trials are going to bring forward another generation of therapies that will make it even more effective to treat Alzheimer's disease, its symptoms. Parkinson's is next, and its symptoms. Uh, and they are growing at a significant rate across the United States, independent of race and ethnicity, and the world. So we're also thinking about how do we make our trials and our conversation with people hit with these diseases, how do we make those conversations relevant uh, across the globe, but particularly for GAP, where we already are. That's North America and Europe. And we aspire to learn from there to go to South America and parts of Asia. I want to just underscore one thing. Doing this in this environment with a extremely clear-eyed view of what good science looks like is the mandate we pursue here at GAP. We're not going to stop. We're not going to be skewed or biased about it. Uh, we're just going to do the right thing for the right reasons for everyone that we can reach within our earshot. Uh, and it's going to take time to scale on that big a scale, but we've made great strides uh, already, and we plan to continue to grow in that regard. So it's with that in, uh, intentionality, access, transparency, that I want to introduce you all to what I think is going to be just a terrific 4-hour conference at a time when we need exactly this kind of conversation. I want to thank all our panelists. I want to thank all my team members who are prepared for this endeavor. And I hope what's going to come out of it is a newfound or at least a redoubling of our commitment and some insights into how we can do our job better. So with that, I'll give it back to you, Tamiko, with my thanks and gratitude for all that you and your team do.
Thank you so much, Sean. And I could not agree with you more that this is the best moment, right, to be having a conference like this. And I wanted to say before we move on, I just want to take the moment to acknowledge the commitment and hard work of our friends and our study participants and community partners and organizations. Like John said, I understand that this work is not always easy, right? But we must remember that we're all in this together. Thank you for continuing the vital work you do to ensure diverse representation, not only in AD trials, but across all clinical research. We are thrilled, and we are promising you it will be a day of insightful discussion, conversation, and information that will be shared today. I did want to go through the agenda just to give you all a sense of what is in store for today. We just had our conference kickoff, and I'm excited to host our first session, Finding Community in Dementia, Calling All Voices. And we're going to have a fantastic group of panelists who will be providing their own perspective, right? And after that, we will hear from Dr. Mikkel Key regarding Alzheimer's disease, women's health, and intersectionality. And then following that, we'll have our session 2, which will be the male perspective on brain health, hosted by our own Justin Ford. And then we're going to actually have a break. And during that break, we're going to have a brain health initiatives in Bahamas, what Dr. Teresa Clark is doing in the Bahamas, which will be introduced by our own Adriana Delgado. And during this time, we just want to remind you when we do that video to just turn it up a little bit. It might be a little muffled because it will be during our break, but just excited to share that. And then our session 3, reframing commitment Ensuring Inclusive Clinical Trial Enrollment When DEI Isn't the Message, which will be hosted by our very own Paula Atkinson. And then we will have session 4, From Campus to Community, How HBUs Can Drive Inclusion in Clinical Research. And that will be hosted by Mia Chester. In our session 3, we are thrilled to present to you our Equity in Motion, Accessing Understudied and Underserved Communities with Mobile Research Units, or MRUs. And that will be a session introduced by our own Diana Basada, but then also you will hear from our mobile research team that have been very active and busy in the community. And then we're looking forward to our keynote address from Mr. Raymond A. Judson, who is a co-founder of Aging While Black, and he will be introduced by Mia Chester. And we will close out our conference with a question and answer. So if you can, please utilize the chat feature for any questions and answers that we will have at the very end of the conference. But we're excited. As you can see, it's a really full agenda today, but it's going to be great discussion and great conversation. So thank you so much. With that being said, we're going to go ahead and go on to our first panel, which I will be moderating. And we're going to give a little bit of time for our panelists to join. And I'm going to do an introduction of our panel and have each panelist introduce themselves. Yep. See, they're coming on. Yes. Hello. Hi. Yes. Hi. I see all of our panelists. Great. You all look wonderful today. Thank you all for joining us. So again, our panel name is Finding Community in Dementia, Calling All Voices. I'm serving as a moderator today. As you can see, we have our panelists, Brian VanBuren, Jessica Lo Kim, Dr. Paula Mueller, and Dr. Debra Tann. I'm going to have them introduce themselves, but I just wanted to give a brief overview of what our panel will focus on and some of their backgrounds. The Calling All Voices panel today will provide attendees with the opportunity to hear and learn from the diverse perspectives of people living with dementia or MCI and their care partners from communities that are marginalized, underserved, and underheard. This is a seasoned group of professionals with a rich and continued commitment to the space in their communities. What is more, we are coming to the conference with established and accessible white papers that they have featured with community and podcast interviews from all participants, featuring a Spanish version as well. So I'm so excited to have these panelists today. And I'm going to start with our first panelist. If you can introduce yourself, Brian VanBuren.
Sure. Hello, everybody. I'm Brian VanBuren. I live in Charlotte, North Carolina. I was diagnosed in 2015 with early onset Alzheimer's. It wasn't a surprise because I'm third generation in my family. My mother died 8 years ago from it, and both my grandmothers died from it, but back then they called it senility. They didn't call it Alzheimer's. So it was given that I was eventually going to get it. And the good thing about it is I've been diagnosed for 10 years and I'm still able to live alone and with the help of a service dog and Alexa.
Oh. Thank you so much, Brian. That is, wow. That is amazing to hear, but thank you so much for sharing that. Jessica, look him, if you can please
Sure.
provide.
Hi, everyone. So glad to be here. Thank you, Tamiko, and the GAP team for inviting us to be part of the session. So I'm an educator, consultant in the aging services space, but I was the project coordinator for the Asian community part of the Calling All Voices project, hosted and led by Dementia Action Alliance.
Great. Thank you so much, Jessica. And can we have an introduction from you, Dr. Paula Mueller?
Sure, thank you so much for having us. I'm Paula Mueller. I'm the founder of Careline 360, a company dedicated to offer tools to aging adults for them to, technology tools for them to age gracefully and with good quality of life at home. But in this particular situation, I was the coordinator for the Hispanic Latino project, where we interview people with lived experiences as well as their care partners. And we're excited to share what we learned in this panel. Thank you.
Thank you so much, Dr. Mueller. That's great. And then Dr. Debra Tann.
Oh, yes. Good morning to some, good afternoon to many, and certainly good evening, because I believe there's a cross section all over the world listening to us on this mid afternoon. Thank you for having us once again. To my esteemed panelists, thank you for being here with me. I so appreciate you. Um, Again, I am Dr. Debra Tann. I bring you warm greetings from South Georgia, rural South Georgia. I have a rural slant. I'm in Valdosta. And we're just thankful to be here. I want to give a brief, well, I guess I better tell a second or two about who I am. Um, I'm an advocate, I'm an educator, I'm a mom, I'm a spouse. I'm also committed to the dementia space in a holistic kind of way. I am the CEO of Reminiscent, which is a brain health organization to help families that have been given a recent diagnosis of one of the diseases as they relate to dementia. So it's a privilege to have that opportunity to serve others. And Dr. MaGee Rodgers, you spoke to the white papers and the podcast. If people would just visit debraondementia.com, they can actually see the papers and read them, and certainly hear the podcast. So they are readily available for the listening audience. But quickly, I would like to give great credit to the visionary of all of this and why we are here, and that is to Karen Love. She had the vision of this. I started out with her with my portion and commitment and contribution, if you will, to calling all voices. She retired, and of course, kind of left it up to me and the rest of the team to pull it together for the Hispanic community and Asian communities, of which you're going to be hearing more about. But the Black communities and the LGBTQ community, which Brian and I were a part of initially, was the kickoff versions of what we're going to be discussing today. So I have to give credit certainly to Karen Love and DAA, Dementia Action Alliance. Thank you.
Thank you so much, Dr. Tann, and thank you so much for sharing those resources for people to check out. But yes, that was fantastic introductions, and I would love if we can just jump into some of the questions that I have for you all today. And as you're in for a treat. This is going to be again a great conversation, a great discussion. My first question I would like to pose to you all: are there cultural beliefs or stigmas around neurodegenerative conditions in your community that delay seeking care? And I'll start with Brian or whoever would like to jump in.
Sure. Unfortunately, that's the case. I belong to a Black support group for caregivers. And out of the 20 people in the group, maybe only 2 have revealed the diagnosis of their loved one. So there's a thing about shame and unnecessary fears, but we don't talk about mental health issues for the most part, especially not dementia and Alzheimer's.
Yes. Yeah, yes, and I concur with you, Brian. That is true, especially in the African American community, right? There are stigmas that exist. So thank you so much for sharing. Dr. Mueller, do you have?
Yes, absolutely. That is not different from the Latino community. We don't talk outside of our families. We share a lot with our families, but not outside, especially in relationship with mental health and dementia. And that is probably one of the main reasons why the people seek diagnosis way too late, and then there is a lack of resources, and we will talk about that. But it was a reality that we found as part of this study, as part of this research, that the Latino community, they find the diagnosis, if they find it, because many go undiagnosed way too late when the disease had progressed too much. So, and that has the consequences of a toll in the family and their care providers. So definitely there is shame, secrecy, it's not shared, and there is a lot of misinformation and lack of information about the dementia and these neurodegenerative conditions.
Yeah, and that's why it's so important, right? You have to consider the family, right? A part of the whole process, right? But yeah, thank you so much for sharing, Dr. Mueller. And Jessica, do you have
Yeah.
any?
Very similar to what my colleague said, in the Asian community, we don't often talk about it. And that's what I heard loud and clear from the interviewees. Sometimes it's because it's a belief it's dementia is a normal part of aging, and that's a misunderstanding. Sometimes there's a belief that it's due to karma or they've done something bad in their past life. What I would like to say is that when the Asian community keeps it quiet, it is due to love and the desire to preserve dignity and harmony.
Right.
And so I just want to make that very clear. So yes, there is some silence due to all those reasons my colleagues mentioned and as I just mentioned. But it's out of love and respect and wanting to preserve dignity. The other thing I want to mention is that what came up in the interviews were comments that the healthcare system hasn't always been very supportive and safe. And so there's also that factor in why maybe Asian community members didn't seek out help. So they want to keep it private, they want to keep it to themselves, but also because they didn't feel safe or that the healthcare system was culturally responsive to their needs.
Wow, thank you. Thank you so much for that perspective, right? I think we definitely need to be aware, right? Especially working in the space of those cultural beliefs, right? From different communities. So thank you so much for sharing that. And Dr. Tann, do you have
I
any?
think my panel has done a superior job placing things in the right perspective in terms of conversation. I would just like to add, just perhaps the consideration of why the stigma continues is because I think, as an educator and lecturer at Georgia State University, that it is due to the lack of education. It's just when you don't know, you don't know what you don't know. And so that is why it's important to have these conversations to make sure that people are educated so they can have access and be a part of certainly the solution in terms of perhaps a clinical trial or something along that line. So definitely access is critical. Uh-huh.
Mm-hmm. Yes, I agree. And like you said, a lack of information, and there's some misinformation out there too. So yeah, it's definitely important that we address that.
Yeah. Before we leave this,
Yeah,
Dr. Tamiko, I
yeah.
wanted to say that when I was interviewing my population,
Mhm.
the Black community, there was an awful lot of mistrust. And I constantly heard Tuskegee referenced. And of course, there are many, many others, but certainly Tuskegee is renowned in terms of what happened, the atrocity. But I think there's a lot of mistrust still. And so I am working hard to dismantle that as well. So mistrust is key.
It is key. You're right. And we can't forget, right? Some of those atrocities that occurred and that mistrust, right? And how we can, right, earn the trust and improve the trust in these communities. So thank you, Dr. Tann, for the
I
work.
wanted to say that
Yeah, go ahead, Brian.
she was talking about the Tuskegee study. My grandfather died of syphilis back in 1953.
Oh, wow.
And that's during the time where they were not giving patients penicillin. They were wanting to see the long-term effects on people. And in reality, what ended up happening is my grandmother also ended up developing it as well.
I'm so sorry to hear that. And see, yeah, and that's your story, right? You share and like you said, it is so important, right, that we address those mistrust issues, right, and ensure that people are informed, right, and there is education, and we're providing access. So thank you all for your perspectives on that question. My next question is for you, Brian. What unique challenges do LGBTQ plus individuals face when diagnosed with a neurodegenerative disease like Alzheimer's, Parkinson's, or ALS?
They, hold on a minute. Okay, you need to repeat the question. I'm sorry.
Yeah, you're fine. No, you're fine. So what unique challenges do the LGBTQ plus individuals face when diagnosed with neurodegenerative diseases like Alzheimer's,
Right.
Parkinson's, or ALS?
Well, the first issue for many of us is denial I myself, even though I was diagnosed in 2015, I knew prior to that something wasn't right. But to be honest with you, I didn't want to lose my job. But after I got diagnosed, I ended up losing my job anyway. So, that's what happened. And then the other issue for many of us is isolation. We don't create safe spaces for us in terms of other people in the community. There's a lot of support groups out there that we just have to hook up with and acknowledge that they're willing to help us, and they have a lot more information that is very important that is given to people of color, especially in LGBT.
Mm-hmm. No, that's great. So then you have to create your own support network then?
Oh, absolutely.
Yeah.
Because as far as the definition of family, often when people say the word family, they mean the nuclear family, biological, legal. But many LGBT people like myself either do not have a relationship with their family of origin, or they may have strained relationships, but many do not have children, as I don't. So when discussing family members or other supports, considering using terms like network of support, chosen family, or loved one, it makes it clear that family does not necessarily mean family of origin or children.
Good point.
That's an excellent point. Thank you so much for that,
Yes.
because I think a lot of people may not know that. So that's a great point. Thank you so much, Brian, for sharing that. So I wanted to go to our next question and pose this is, what roles do language access or health literacy play in navigating these diseases? And I'll start with you, Dr. Mueller.
Sure, thank you for making that, for posing that
Yes.
question, which is it's a huge issue in the Latino, and like Jessica will mention later, in the Asian and other communities. Just one situation that the persons that we interview mentioned is that as you progress with the disease, even you may have proficiency in English. As the disease progresses, you feel much more comfortable in your own mother tongue. Even to understand the diagnosis or the options for care, it will be so much helpful if they are in your own language. And also being, what we usually say is being humbly respectful, but being understanding that you may not have all the answers, but just acknowledging the differences with the others. So having resources in the language at the level that is understandable by common people, but not a medical professional, is so important. It's overwhelming, the diagnosis, and there is so lack of resources of what to do next, and we will talk about that. But feeling getting the diagnosis and not knowing what to do next is something that our community experience quite a lot. So the language plays a big role in acknowledging the need of developing resources, and is very, very important.
No, you're right. That is so important. You're right. And we really need to be mindful of that, right?
Yeah.
In our day to day. Yeah, definitely. Thank you so much, Dr. Mueller.
May
And
I build
Jessica.
on that?
Yeah, go right ahead. Yes, please do. Please do.
Thank you so much, Paula. It's true in the Asian community too. Having access to information in the language that is, native to them is so important, because for many of the people who I interviewed, their family members who are living with dementia, or they themselves, English was a second language. And so we know language shapes not only how we talk about dementia, but how we get that information. And with that information, then we know how to access help and know what that dementia journey could look like. So making sure that there's linguistically and culturally responsive resources available to people are really helpful. I just want to share a quick story. One of the interviewees that I had a chance to listen to their story told me that the family members were often the translators. And so there was a particular incident where the parent was living with dementia. The adult daughter, went with the parent to the healthcare service provider, and the assessments and diagnostic tools were all in English. So she was acting as the translator, the adult daughter, and something was lost because that adult daughter also wasn't a healthcare professional. So that led to not getting access to an appropriate diagnosis, not getting probably access to the resources and supports they need. So this is an important point that we need to be aware of. The other thing that I want to mention is that too often the diagnostic tools that we use in North America might not be culturally relevant. So that needs to be taken into consideration as well. So not only linguistically, but culturally reflective.
I could not agree with you more, Jessica, as it relates to some of those tools that we have, right? Like you said, they may not be culturally appropriate, and we may need to look at revisiting those, right? Because some of those tools we utilize in our clinical research trials as well. So, and we need to make sure, like you said, linguistically, and they're culturally appropriate to utilize, right? But no, thank you so much for sharing that example.
And if I may add
Yeah, go ahead.
a quick point, that Jessica point, that is, if we're not using the correct language or communicating with the people appropriate, well, that leads to misdiagnosis, and that leads also to lack of treatment and care options. It's a whole change of misunderstanding. So it's so important to be aware of the consequences of this mismatch in the communication, or the communication gap, that as a consequence of not having a linguistically appropriate and culturally appropriate means of communication and information.
Absolutely. It goes back to your earlier question about delay in accessing appropriate resources and that diagnosis. So important. I know Debra wants to say something too.
Yeah. I just want to quickly say this as it relates to what my colleagues have already stated. This is just my humble opinion, Dr. MaGee Rodgers. I don't think no one should be denied the possibility to being healthy, just being healthy, guys, for belonging to a group that has historically been his historically been socially or financially disadvantaged. And certainly language factors into all of that as well. So I'm just talking about healthy people. And so I think that I would like just raise the consciousness of how important it is. It becomes moot to me what that barrier may be, that impasse may be, because I think everyone should be entitled to being healthy. And I hope that as we think, historically, it's been at a disadvantage. And as we move forward, I'm hoping that things become advantageous.
I love that. Thank you, Dr. Tann. We do need to change our mindset, right? Especially like you said, right? Those that are healthy should have access, right? There should not be a lack of access. We all should have that access, equal access, right? So yes, thank you so much for that, Dr. Tann. Okay, I have another question for you all. How do multi-generational households or family structures influence the management of these diseases in your community? Because I know we have a lot of multi-generational households, right now, currently at an all-time high. So just how does this, the management of this in your community influence, right? The management of this of these diseases in your community. And I'll start with Brian.
I guess one thing is to locate caregivers in regards to support group, making sure existing groups are welcome to LGBT people so they do not feel alienated or left out. The other thing that's very important is our doctors and other staff need to be educated when it comes to LGBT issues. My friend has a much older doctor and told his doctor, he was a member of the LGBT community. Doctor had no idea what that was.
Really? Oh, wow.
Yeah. Stupid.
So he had to explain it to him? Did he have to explain it to him, or?
You have to explain it to exactly.
Wow.
And that's not your goal. You should not be having to educate your doctor. Your doctor should be educated. But I find the younger doctors are much more equipped to deal with dementia and Alzheimer's as opposed to the old guys.
Right. Yes. Wow. Well, thank you for that's pretty disheartening, right? That he had to explain that. But again, you all are raising some great points for us to just be aware, right, of what's going on. Yeah. Dr. Tann, did you have?
Oh, no, I'm good. Thank you.
Okay. Dr. Mueller,
Yes,
how do
thank
you?
you.
Yeah. Yeah.
In the Latino community, we rely heavily on family, and it's a multi-generational household. So children experience what grandma or grandpa are experiencing. So they often are also family caregivers in their role, taking care of grandma or grandpa after school. So it's important to educate the multi-generations as well. There is a beautiful program in Wisconsin where they were educating children about dementia because it helps them understand why grandma or grandpa is presenting themselves and how difficult it may be for them, that they are not seeing clearly, that they are not working properly. So it gives them to children the tools. Yes, the Latino community and many times we listen from the people that we interview how they have left jobs, they have shift. There is the financial burden of the disease that is in many cases absorbed by the families. So the families play a very critical role in caring for dementia and other. So the family becomes the resource for everything, for the care, the medical care, and also the financial support. So it's a very strange. So that I couldn't emphasize more the important role that the family plays, and many levels.
Oh,
I
thank you.
became an advocate and public speaker. I spoke at a lot of conferences, some as many as 1,400 people. Never once met another African American who identified with having dementia or Alzheimer's. So it wasn't until I met a woman by the name of B. Smith, book signing, and her husband told me, I came out to them basically and told him that I had Alzheimer's and that I was gay. He said, well, now you have responsibility to educate people and become an advocate. And that's what I did. So I have been active, 10 years now? And I even was included in Dr. Sanjay Gupta's latest book. He featured me.
Oh, wow. That
So
is
I'm famous.
You are famous, Brian. That's awesome. Thank you so much for sharing. You are definitely, yes. And Jessica, did you have a?
Yeah, I just wanted to add, so similar to what my colleague said about the Hispanic Latino community, in many Asian communities, there's a strong belief that families take responsibility for their loved ones or their immediate family members. And there's a lot of pride that comes with it. I want to share one interesting stat. Asian older adults represent less than 2% of residential care residents in North America. So what I wanted to highlight was with this stat is that their families are often the ones that are caring and supporting. And even if they do not live in multi-generational homes and they're caring at a distance, the responsibility still often lies with the immediate family. And there's a strong emphasis around that. And it's really important to know. The other thing I just really want to quickly mention is that the Asian community is very diverse. So it's really important to understand each person that you're supporting or each group that you're getting to know, because there is some differences. So some families live in multi-generational homes and some live apart, but that care component is still a key component for families.
One of the things that happens in African American communities is my mom was in a couple assisted living homes, and there was never another Black person in any of those homes. And the reality is that Black family members quit their jobs, stay home, and take care of the loved one. And many times they're not equipped to deal with all the issues going around So that's why support groups especially important for minorities and people of color.
No, you all, wow, you've made some great points there. And just to go back, yeah, Jessica, for that reminder that even within different communities, there is diversity within those communities, right? And to be mindful of that and not to group them all together because there could be, differences, but the whole care, right? And how we take care and love our family members is the same, right?
Right.
Yeah, so thank you so much for your perspectives on this. I do have another question as it relates to community-based support. So, what kinds of community-based support systems exist or are needed for people living with dementia, caregivers, and families? And I'll start with Brian with you.
Well, there needs to be caregiver respite or support groups, making sure existing groups are welcoming to LGBT people. Contact aging service providers for resources and support. And if you run a caregiver respite or support group, be sure to train facilitators and staff on LGBT cultural competency and communicate that your group is open to everyone.
I love that. Thank you so much, Brian. We do need to be aware and people need to be trained, like you said, to the LGBTQ plus cultural competency. Thank you so much for that reminder, right? Yeah, it's so important. Dr. Tann, do you have anything to add to that?
Yeah, I'll go ahead since I took a pass on the multi-generational one. While I know that family is quintessential, we all know that. I really wanted my colleagues to weigh in on that, but I can speak shortly to what kind of community-based support systems are in existence. I would like to say, though, 10 years ago when I began in the space, there was little to nothing. And right now, there's a plethora of things. And so I'm so pleased by that. And a good percentage of them are absolutely free. It's out there for the getting, and it's up to us to take full advantage of the support systems that are available, the resources that are available, even with such as myself and Reminiscent, we are available. And there are so many more like myself, because I'm finding over the last 10 years, particularly the last 3 to 5, that people want to empower, encourage, and to educate. And most things are free. So I'm excited about that, Dr. MaGee Rodgers.
Thank you so much, Dr. Tann. Yes, it is hopeful, makes you hopeful, right? That there are more resources that are available than there are compared to 10 years ago, like you said, Dr. Tann. So thank you so much for sharing that. And Dr. Mueller?
Yes, thank you. And I want to emphasize the comment that Brian made about the importance of support groups and and then healthcare providers that they are aware of those support groups as a resource, and that if nothing else, after the diagnosis, guide the people to reach out to those support groups, because within those support groups, the persons are going to find resources, support, companionship, an opportunity many times to just express their frustrations and their anxieties and just share what they are going through as the persons living with the disease as well as their care partners. So something important to, if nothing else, that healthcare providers are aware of those resources that are, like Dr. Tann said, many of them are free, and just guide the persons and give them that hope that there are steps, there is a way to go and navigate the disease, and that is not the end of the end of the tunnel. It's just the beginning, the path to a transition to another way of life. But there is hope in dementia.
Thank you so much for that last thing, that there is hope in dementia. And thank you so much for sharing that, Dr. Mueller. And then Jessica, do you have any?
Just one word to build off of what my colleague said, building bridges. There are resources out there. We need to be more aware of it, build those relationships, build those partnerships so that we can collaborate, because a lot of the Asian communities will turn to their trusted network. So building bridges, really key.
I love that. And building bridges helps to build trust, right? If you can, build bridges and build relationships with those, community partners, community organizations that in turn will help hopefully you to build trust too in the community. So I love that. Thank you so much. All right. Well, I have a question that I love to pose to all of you about the future, right? Or right now, like what gives you hope and where do you see opportunities for change? And I'll start with Brian.
Good question. Um, I'm hopeful for the most part. I don't believe that it'll be cured in my lifetime because I'm 74 years old, so I'm a little bit too old. But for other people, I think that it's very important to be optimistic about your diagnosis. When I got diagnosed, my doctor told me to go home and get my affairs in order, and that was it. No references, no referrals, no nothing. So I went home for 2 months waiting to die in my bed, and finally realized that that's ridiculous. So I reached out to the Alzheimer's Association, and that changed my life for the better.
That's great. Thank you so much, Brian, for sharing that. And Dr. Mueller?
Yes, so that was the message from all the persons that we interviewed that participated, that they are like Brian is not staying there and just hiding in their beds. They are out there in the community sharing their experiences in different ways. I mean, some of them are making films, some of them are sharing the experiences of their loved ones in social media. Someone of our panelists said, if we don't share, if we don't communicate, if it's remained hidden, there's no opportunity for progress, there's no opportunity for change. So we have to, I think it's very hopeful that, like Dr. Tann said, in the last 10 or probably most recently, in the last 3 to 4 years, people are out there communicating and making us all aware. And I think that we starting talking about, we can find the ways to live better and share experiences, share what is working for. And also be something very important, that the people feel that they are not alone, that they are part of the community, that is not something that is just happening to them, but that there are resources out there.
I love that. Thank you so much, Dr. Mueller. You're not alone. Thank you. Dr.
As-
Tann?
Yeah, as it relates to hope, I am so optimistic I can't even contain myself. But I want to share this in terms, I look for a poem that I thought really kind of encapsulates what the Black community that I interviewed, what they feel about hope. And it's by Leland Watson. And this is what I believe they conveyed to me. If you have come to help me, you are wasting your time. But if you have come because your liberation is tied up with mine, let us work together.
Mm, mm. I love that. That's powerful. Thank you. Thank you, Dr. Tann. I love that. And then Jessica? do
Oh
you have-
goodness, that's hard to follow.
I
That was a
know.
mic drop moment.
Sorry.
You know, like my colleague says, I am so hopeful because more people from the Asian community are feeling like now's the time to speak up and share stories. And so I would say it's also a good time for us to invite them in as co-creators, co-designers into research, into service delivery and design, into policy. Now's the time to engage the community because by doing that, we can make it better. Just want to share one quote from one of our participants, Mario Gregorio, who is a dementia advocate. He's amazing. He lives with dementia, and he said one powerful quote, and that is, one small voice added to a group of many voices can make a thunderous impact in creating change for people living with dementia and their care partners. That's the future. We need more inclusion. We need more voices in everything that we do.
So true.
Thank you. That I tell you, that is the mic drop right there because I can't believe we're at our time. This was such a great conversation and discussion. I could go on and continue, but I want to let our other panelists have time. But this has been a tremendous honor to serve as your moderator for today. It was great insight, great discussion. We do have questions that we will save for the end because we're going to jump into our next session. But again, thank you all for the great conversation today. And we will probably be in touch with questions later on. All right. Thank you so much.